Assalamu alaikum, namaste, sat sri akal, shalom and good day. You are listening to Awaz Community Radio. And today we'll be talking to Sadia from Joe's Trust. Now, if you would like to get in touch with us, give us a call on 0161 839 9817. You can email us awazcommunityradio@gmail.com. We're on Facebook, just type in Awaz Community Radio or tweet us at awazradio122. Thank you for listening to Awaz Community Radio. Your host for today is Saira, and my guest is Sadia from Joe's Trust. Hi, Sadia.
Hi, Saira.
Thank you so much for coming over.
Thank you very much for inviting me.
It's great to have you here, and I think it'd be great for our listeners to hear a bit more about what Joe's Trust is and who you are.
Yep, so Joe's Cervical Cancer Trust, we are a national charity, and we provide information and support to anybody who's been affected by cervical cancer. And we do that in a number of ways by providing services. So we do have a helpline, we have forums, online forums, we have publications as well, and Ask the Expert service. So we do a whole host of services really, so yeah.
Brilliant. Now, can you tell our listeners about the importance of screening for cervical cancer?
So my role is Public Health Engagement Coordinator for Manchester, and much of my role involves raising awareness about the importance of screening, cervical screening, or otherwise known as smear test, which is a word that all women understand.
I think you're right. We have to say that to our listeners, don't we? Screening and smear test, same thing.
Yeah. So the importance of going for your smear test, I can't stress it enough, really. It's about saving lives. The cervical screening program is known to save well over 5,000 lives a year. And if you look at cervical cancer itself, there are well over 3,000 cases in the UK every year. And what screening does is it basically helps to pick up any abnormal cells that may be developing within the cervix. And it's a very, very short test. It takes only a few minutes. It occurs in the GP practice. It's usually a practice nurse that carries out the smear test. And a swab is taken of the cells within the cervix. Now, those are sent off to the laboratory, and those samples get checked to see if any cells are abnormal. It's very rare that, cervical cancer is found after having a smear test. Most of the time tests come back normal, but for those tests that come back abnormal, then a treatment is offered, or a woman can be monitored.
And what is Joe's Trust doing across Manchester to increase the uptake?
So the uptake of screening is at a 19-year low. So it is dropping, and particularly within the Black and ethnic minority communities, my role is to really encourage women to go for their screening. So I'm working with GP practices. So we have the GP engagement side, where I'm going in and delivering interventions, trying to help GP practices increase their uptake, and I'm doing that in a number of ways. So for example, like having a well women's clinic or drop-in, where a group of women will come and I will discuss with them why it's important to go for screening, what it actually is for, because there's a misconception out there that it's to look for cancer. Well, it's actually to look for abnormal cells before they turn into cancer. But in the sessions also we talk about dispelling myths and beliefs as well. The other type of interventions we deliver is, for example, telephone clinics. So I can go into a GP practice and, ring up patients who are not attending or who are overdue and speak to them on a one-to-one basis. And also we're trying to break some of the language barriers as well. So I can speak Urdu and Punjabi as well. So I use some of those languages to try and interact with the women and to give them facts and information so that they can make an informed choice, and then come in for a smear test if they're happy to.
So going back to what you said about it being the uptake being at a 19-year low, do you know what the reasons are for that?
I mean, I think there are a number of reasons as to why women are not actually going for their smear tests. If we look back a few years ago, where the uptake of screening kind of spiked when Jade Goody passed away, and we saw, quite a high number of women coming through the doors having a smear test, and since then it's actually dropped. Some of the reasons that I'm hearing on the ground is that, it doesn't affect my community. Cervical cancer isn't common in my community. I don't think it's a priority, so I don't need to go. Other reasons, I'm quite busy. I can't get time off at work, or when I want to get an appointment, it's not available at a convenient time to myself. Some women might know the importance of screening, but might not make it a priority because they have so many other things to deal with in their lives. Especially if you look within the South Asian communities, a woman has multiple roles within the family, within the society, within the community as well. She is seen, as the backbone of the family. And when she is dealing and managing with her own family or extended family as well, her own health doesn't really come as a priority, being at the top of the list. So sometimes it's about reinforcing the fact, well, listen, if you're well and if you're healthy and looking after yourself, then you'll be able to, take care of your family and everything that comes with that in a much more effective way. If you don't end up looking after yourself and you do fall ill, then, who is there to pick up on all the things that you're actually doing yourself for everyone?
So you've really covered some of the barriers to screening for the South Asian communities, and you've talked a bit about the risks as well for not going. Can you tell our ladies what the benefits are for going for screening?
Yeah. So, the benefits for going for screening are, if there are any abnormal cells within the cervix, then, in many cases they are picked up. And once they are picked up, then, treatment can be offered. They can be removed before they actually develop into cervical cancer. Now, the development of cervical cancer can take some time, but if you're someone who keeps missing your smears, you're given a chance for those abnormal cells to actually turn into a cancer. So, I can't stress enough the importance of going for your smear test, really. And I would also like to say that, if anybody's afraid of going, if they have any fears, maybe about pain or past experience, then, either come and talk to us at Joe's Trust, or go and speak to your GP or practice nurse, so that they can, they're there to try and help alleviate any of your anxieties and your fears as well. That's what they're there for, and they would be able to support you in making that decision to have your smear.
And about the HPV virus, can you explain a bit more about it and its link to cervical cancer?
Yes, so the HPV virus, or otherwise known as human papilloma virus, it's a very, very common virus. There are many, many strains of HPV. Different strains affect different parts of the body. But in relation to the cervix, there are certain types of HPV strains, that affect the genital area. And those strains are the ones that are responsible for well over 99% of the cases of cervical cancer. It's HPV that brings on the abnormality of cells. So we know that HPV has a link to cervical cancer. Now, HPV usually it's a virus. You can't really tend to pick up any symptoms of it. People won't know if they have it or not. And also, it's usually cleared by the body's immune system. But in some cases, in some women, if the immune system isn't able to clear the HPV infection, then, we say that we call that a persistent infection. And if there is a persistent infection, then that can go on to cause abnormality within the cells. So yeah, as I said, HPV can be normally cleared from the body. It can take 18 months to 2 years to clear. But in cases where it doesn't clear, then that is the risk, that a cervical cancer can develop. The biggest risk of developing cervical cancer is not going for your screening. If you don't go for your smears, how are they going to remove those abnormal cells or treat them or even monitor them? It just, depends on how mild or severe the abnormality is. But, there's certainly treatment can be offered, and cervical cancer can be prevented. It's a preventable cancer.
And the screening process itself, can you talk a little bit more about that for our female listeners?
Yes, sure. So women from the age of 25 onwards will be invited for their first smear. And the cut-off age for cervical screening program, which is provided by the NHS, is 64. So 25 to 64. Some women might be 24 years and 6 months old before they get their first invite, but it's usually when you're between 25 and 64. Now, for those who are between 25 and 49, the invite will occur every 3 years. So you'll get a letter every 3 years to come in and have a smear test. For women who are 50 years old to 64 years old, the invite is every 5 years. And once the letter has obviously comes through, it does explain, that they're inviting you for a smear test, and what it involves as well. And then at the actual appointment within the GP practice, it doesn't actually take that long to have the smear test, only a few minutes. Obviously, when a lady comes in, then the practice nurse will explain what she's going to do, what the smear test is about, and then a woman will have to get undressed from the waist down as well, because they will have to lie on a couch, and then a speculum will be inserted, and speculums come in small, medium and large sizes as well. So if anybody's worried about pain or discomfort, do let the practice nurse know about it. Let them know how you're feeling. And then a sample will be taken from the cervix. So it's usually inserting a brush, and just kind of like scraping around the sides of the cervix, and then taking those cells, which are then sent off to be examined, really, to see if they're normal or abnormal. But I would like to stress that majority of the cases of results that come back tend to be normal. And if they are abnormal, then please try not to panic. There is treatment available, and it's all about trying to remove those abnormalities, or halt those abnormalities, just so that it doesn't develop into cervical cancer. So your risk is greatly reduced once you've had treatment.
StopMusicBoutique.com preview.
Quite often when people are fearful and worried about something, myths can crop up and people get misinformation, or the phrase that's so popular these days is fake news. And I'm glad that you're here, Sadia, and giving out real information and the facts. Can you dispel some myths that affect South Asian communities?
Certainly. So, I've been working on the ground across Manchester, working with the communities, and also, prior to this role, I've worked for well over 15 years within South Asian communities in relation to cancer, and I hear things like, well, it doesn't affect our community, it doesn't happen to us, it's not a cancer that really affects us in the South Asian community, HPV doesn't really affect our community. I've heard that as well, and in actuality, the reality is, yes, it does. Cervical cancer doesn't discriminate. It can affect any community, just as HPV can as well. And I think the kind of stigma that surrounds HPV is that HPV is transmitted through skin-to-skin contact, or through intimate contact or genital to genital contact. And because of that, the stigma is quite rife that, it's not something that affects our community. It can affect anybody. And the key thing is, the screening program is for everybody, regardless of what background you are from. So cervical cancer can affect anyone. Some of the other kind of stories I'm hearing on the ground are that cancer means death, or always means death. And that's quite a deep-rooted belief within the South Asian community. And what we'd like to tell people that it doesn't always have to mean death. Early detection and prevention is key. Early detection and prevention help prevent deaths. And I think what's probably going on, Saira, is that because cancer isn't talked about within South Asian communities as openly as we would like, and because women are not going for their screenings, it's most likely that if they do have abnormalities that do go on to develop cervical cancer, by the time they're diagnosed, it's quite a late stage, which inevitably means that it's going to be a poor prognosis and the outcome may well be dying. So when someone does pass away in the community who possibly had a late diagnosis, most likely, then it kind of reinforces that belief that cancer means death. It's almost becomes like a self-fulfilling prophecy that cancer always means death. Yes, we know, obviously, that many people do get cancer. Some people don't survive. Some people do. But in relation to smear tests and cervical cancer is a preventable cancer in many, many cases. So, we already have the smear test or the screening program there to help us prevent these deaths. Some of the other kind of things I'm hearing is, I heard from one lady who had a completely different health condition, which compromised her immune system. It made her immune system slightly weak. So, which meant that she was more prone to infections, especially UTI infections. And she feared going for her smear test because she thought the smear test would give her another infection. Whereas we know that's not the case. Smear tests don't give you UTIs. They may be, uncomfortable. Will not brush around about that. Smear tests can be uncomfortable at certain times. But, certainly it's not known to be giving you UTI infections at all. And some of the other things I suppose I hear on the ground is I'm too scared to go for my smear test. So there's a lot of fear within the South Asian community that we need to conquer, really. So a lot of the work I'm doing on the ground is working at grassroots level with women, speaking to them about their fears and trying to break down those fears bit by bit, just so that they're fully aware exactly of what it can mean if they don't go for their smears. But also for them to make an informed decision as well. It's all about giving them balanced, factual information so they can make that decision themselves.
And where can our listeners go for support in terms of online or if they want to phone? And I'm so glad you have touched on the fact that there is a lot of fear out there, a lot of worried ladies, not sure who to trust or what's right or not. So can you give us some support in terms of numbers or websites?
Yes, certainly. So you can contact Joe's Cervical Cancer Trust. We do have a helpline, and the number for the helpline is 0808 802 8000. Or you can go on to our website. So we do have a website which has got a lot of information on there. It's www.joestrust.org.uk. And we have online forums as well if anybody wants to use them. You can order materials as well. You can order leaflets. We have really good smear test film It's online. You can view that on YouTube or on our website, and basically that explains the whole process of what a smear test is. It's very visual. It's a lovely video to help you understand what actually goes on during the process, and it's available in different languages. That includes Urdu as well. So, you can also check that out. The other avenue that you can take for support, aside from Joe's Cervical Cancer Trust, is you can go to your GP and your practice nurse as well and speak to them about any kind of fears that you might have around this or any questions. Yeah.
Well, we'll definitely be sharing those links on our social media as well to make sure that our listeners can get the information they need. And I think we're very lucky today, I think, in comparison to maybe 10, 20, 30 years ago, where maybe our mothers, grandparents and so on, they didn't have the access to easy information like we do. We can learn so much more. So let's try and get rid of that fear. Let's try and be braver.
Yes, certainly. And I think, the more that we support each other in all these things as well, and also trying to break some of the taboos within the community. I sometimes hear that people have said once they've been diagnosed, they've almost been shunned by their community and friends because, they think it's contagious, or they think it will bring bad luck upon them if they go and visit a sick person who they think is dying, who very well may not be, who may be having quite successful treatment, but almost seen as an omen, which is not, we know that's not right at all. At that time, that's a time when somebody needs a lot of support. And I think, even in one of the more rare, shall I say, because it's, I want to avoid generalizations as well about the South Asian community, because I've seen a lot of support, that women do get once they've been diagnosed with cancer, a lot of positivity from that. Some women say that they get hindered from going for their smear test because of their husbands, discouraging them. But I've also seen cases where it's the husbands who have really encouraged their wives to go for their smear test as well. So I suppose these kind of reasons and issues exist across all types of communities, and they're not as specific to each type of community. But I suppose one of the rare cases that I did come across a long time ago was when somebody had to actually get their consultant to write a letter and state that their cancer is not contagious. And they made copies of that letter and posted it through to their neighbours and in their community, because they felt that people had stopped coming to visit them. So you can imagine the added burden that they felt. So I think it's about, let's all of us try and help change attitudes. It's fantastic for people who are giving support to people who have been diagnosed with cancer. But I would like to say that, it's easy to say don't be scared. I know it's very easy to say that, but I think it's all about education and knowledge as well. So the more we talk about it in the community, the more easier it will get to deal with, to understand as well. I think it just comes from a lack of understanding of how and what cancer is really, and how it affects a person. So I think we all can work well together to try and improve the situation and the personal circumstances of people who are affected by this disease.
So what other ways can the community help you with your work, Sadia?
Oh, Sarah, I would love for anybody who'd be interested in volunteering for our project. It's a 3-year project. It's been funded by the Tampon Tax Fund. So we're doing this work on the ground in Manchester for 3 years, and we're working within the community. So I'm looking for any willing volunteers who would like to support me in this. We will train them up. We will give them all the support that they need. And it's basically to go out and raise awareness amongst family, friends, and within your local community as well. So, for example, you can do short sessions on cervical cancer awareness and what a smear test is and what's its important. So we can give you full training and materials and support on that. It really depends on how much time you can give as well. So there's no set limit on how much time you can give us. It's entirely up to yourselves how you space out the level of efforts that you put in. But if anybody is interested, then please do get in touch with either yourselves, Awaz Community Radio, who will then get in touch with me, or you can just get in touch straight directly with me at Joe Cervical Cancer Trust.
Thank you very much, Sadia, for your time and for coming in from Joe's Trust to talk to our listeners about the importance of screening for cervical cancer and going for your smear test. Thank you so much.
Thank you so much for having me on, Syra. Thank you. It's been a real pleasure.
You've been listening to Awaz Community Radio, so if you've been affected by any of the issues that we've talked about today or you'd like more information, please go online and, as Sadia said, that there are helplines, there's a website, type in Joe's Trust, and also with Awaz Community Radio, we're going to put all the links up on Facebook and Twitter as well. So please do get in touch if you've been affected or have any questions. Thank you for listening, take care and have a good day.